What could make someone who was still driving to the supermarket and chatting happily with neighbors in the afternoon wake up the next morning, unable to lift their right arm or say their spouse's name? Picture a perfectly ordinary dawn that suddenly turns into lifelong tragedy. That is a stroke during sleep, a silent attacker with no warning signs. According to the U.S. CDC, someone has a stroke every 40 seconds, and nearly 1/4 happen while the victim is asleep, when the body has no chance to fight back. Adults over 65 make up more than 70% of all strokes, and almost 1/3 of nighttime strokes go unnoticed until permanent brain damage is done. This is the dark stroke, the deadly silence hiding inside habits we think are healthy, sometimes in the very fruit you eat every evening. I have seen patients left with only half their brain function, and it is heartbreaking to learn the trigger was a fruit they believed was wonderful for their health. Nothing hurts more than watching their memories, voices, and steps fade away because of those seemingly harmless fruits. It isn't red meat, alcohol, or fried food. Certain wholesome fruits can be silent killers. Healthy for whom? At what age? Under what conditions? Have you ever eaten an apple at night to lower cholesterol, nibbled strawberries for their vitamin C, or believed that mangoes, pears, and plums are harmless because they're naturally sweet? If any of that sounds like you, this video is speaking directly to you. In a moment, I will expose 5 everyday fruits found in almost every home that quietly endanger people over 60. They can overthin your blood, send midnight blood pressure crashing, or silently damage the brain until it is too late. I will give you real solutions, and at the end of the video, a safe morning menu you can use right away. Don't let everyday foods steal your ability to talk with your grandchildren. If you're over 60 or love someone who is, watch to the end. This video could save not only your memory, but your life and the lives of those around you. And topping the red zone list, once marketed as an apple a day keeps the doctor away, is the apple red delicious Fuji Honeycrisp, the silent blood vessel inflamer. Many older adults pick apples for a healthy snack, assuming all fruit is harmless. In reality, sweet apples, especially Fuji, Honeycrisp, and Red Delicious, pack far more natural fructose than most other fruit. In younger people, the pancreas still churns out plenty of insulin, so one apple is trivial. But after 60, insulin regulation slows and liver enzymes that process fructose decline. Eating a large 180g apple in the evening can create a blood sugar peak that lasts 2-3 hours, exactly when the body is entering deep sleep. That peak prompts the liver to release a surge of triglycerides, making blood thicker and stickier. Cerebral blood flow drops slightly yet persistently, stretching the vessel lining and sparking low-grade inflammation. This endothelial inflammation is like a dim night light. You don't see it, but the tiny embers can ignite micro-strokes, minuscule nighttime strokes. You wake with a fleeting heavy head or mild numbness that vanishes in seconds, so the warning is usually ignored. Another seldom noticed point: commercial apples are often coated with protective wax that carries residual oil-based pesticides. Seniors with weak teeth tend to peel the fruit, then eat proportionally more flesh, concentrating the fructose load. If they keep the peel, those chemicals dissolve slowly in the stomach, forcing the liver to divert detox enzymes, which can raise liver enzymes and disturb blood fat handling. Evening diabetes or blood pressure medicines may lose potency because the liver is busy clearing that chemical burden, unintentionally weakening nighttime protection for the brain's vessels. After months of the one apple after dinner routine, blood work may reveal a mild CRP rise, fasting glucose wobbling at 110-125 mg/dl, triglycerides creeping upward, and borderline high liver enzymes. In the brain, microstroke damage accumulates like tiny nicks in an electric cable. Short-term memory falters. Patients say they forget strangers' names faster or have to reread a sentence. Families chalk it up to normal aging until a full stroke finally strikes. First fix: change the timing. If you insist on apples, move them to 9-10 a.m. or at least before 3 p.m. The body still has the afternoon to burn the sugar and clear triglycerides before bedtime. Second, shrink the portion. Swap a big apple for half of a small one, approximately 80 g, and pair it with 2 almonds or a slice of reduced-fat cheese. Fat and protein anchor the sugar so blood glucose rises gently instead of spiking. Third, treat the peel properly. Soak apples 10 minutes in warm water with 1 tablespoon baking soda, rub lightly, then rinse. The soda strips wax and some oil-soluble pesticide, easing the liver's load. Long-range tactic. Limit apples to 3 evenings, a week maximum, alternating with pears, guavas, or just-ripe bananas. Fruits lower in sugar and richer in potassium or sorbitol that move water slowly and lessen hemodynamic stress. Patients on sulfonylureas or SGLT2 inhibitors should check post-meal glucose to find their personal fruit threshold. If it exceeds 180 mg/dl 1 hour after an apple, cut the portion further or switch fruit entirely. In short, apples aren't bad, but in seniors their high fructose, chemical-laden peel, and late-night habit turn them into a silent vessel inflammator. Adjusting time, size, and peel treatment sharply lowers microstroke risk, safeguards memory and cerebral vessels, and lets the heart and liver enjoy a quieter night shift. 2. Red plums, the GI bomb affecting heart and brain. Red plums, with their bright sweetness, thin skin, and juicy flesh, are a popular summer dessert. But that very sweetness conceals serious risks for older adults. Plums have a high glycemic index, around 53. When fully ripe, their free sugar content increases, causing blood sugar to spike rapidly about 30 minutes after eating, higher than an equal weight of white rice. In people over 60, insulin sensitivity is reduced, and the liver's ability to metabolize fructose is impaired. This sugar spike forces the pancreas to flood the bloodstream with insulin in the late afternoon or evening, and by midnight blood sugar plunges. The result can be dizziness, sweating, and a racing heart that awakens the sleeper. Worse, nighttime hypoglycemia often brings a temporary drop in blood pressure, reducing cerebral blood flow. Upon waking, patients may feel momentarily foggy, misplace their glasses, or slur their speech, signs of nocturnal cerebral hypoperfusion. Plums' natural laxative effect compounds these dangers. Ripe plums contain sorbitol and insoluble fiber, which draw water into the intestine and trigger a wave of peristalsis about 3 to 4 hours after eating. For seniors on diuretics for blood pressure or heart failure management, fluids already lost through the kidneys are further depleted in loose stools. Blood volume falls and blood pressure can dip sharply in the early morning, prime time for transient ischemic attacks, TIAs, or microstrokes. Heart rhythm may also wobble as potassium and sodium wash out in the stool. Some patients even develop sinus tachycardia or scattered premature beats at dawn. Plums can also outsmart medications. Sorbitol in plums and polyethylene glycol in over-the-counter laxatives, e.g. Miralax, both pull water into the gut. Combining a bowl of ripe plums with a laxative dose can trigger explosive diarrhea, doubling the drop in blood pressure and electrolyte loss. In patients with low ejection fraction heart failure, one night of severe diarrhea can slash blood volume, drop cardiac output, and cause breathlessness or mild swelling by morning. Signs of transient heart failure decompensation. To minimize risk, older adults should 1. Limit to 180 g plum, choosing fruit that is still slightly firm with smooth skin rather than overripe. 2. Eat before 3 p.m., giving the body the afternoon to burn off sugars. 3. Pair the plum with 5-6 almonds or a slice of low-fat cheese. The added fat and protein anchor the sugar, lowering the blood sugar peak. 4. Avoid plums entirely on days when taking an afternoon diuretic or a laxative. If you must have one, drink 250 ml of lightly salted water, TSB salt in a glass, to replenish electrolytes. Patients with orthostatic hypotension, atrial fibrillation, or New York Heart Association Class II or higher heart failure should consider eliminating ripe plums from their evening menu altogether. When shopping, wash plums thoroughly and gently scrub the skin in warm water mixed with a splash of vinegar to remove wax and oil-based pesticide residues. These chemicals can burden the liver, indirectly impairing cardiovascular medication metabolism. 3. Bartlett or Anjou pears, the natural blood thinners. Bartlett and Anjou pears have long been touted as heart-healthy thanks to their high flavonoid content. But that very anti-inflammatory green coat poses a hidden risk for older adults on antiplatelet medications such as aspirin or clopidogrel Plavix. The flavonoids in pears mildly inhibit platelet aggregation. This sounds beneficial, but when combined with a doctor-prescribed anticoagulant, your blood can become thinner than needed. If you snack on a soft, ripe pear before bed, your blood pressure naturally dips in the early hours, and fragile cerebral vessels may leak at weak spots, creating microscopic brain bleeds. Many people wake feeling a brief heaviness in the head or momentary light sensitivity, signs that microhemorrhages may already have occurred. There's another issue. The riper the pear, the more sorbitol it contains, a sugar alcohol that draws water into the intestine. Eaten around 8-9 p.m., sorbitol triggers a strong bowel movement 3-4 hours later. At 1 a.m., you may dash to the bathroom with loose stools. After that purge, dehydration can cause further blood pressure drops. Seniors with fragile cerebral arteries risk dizziness or imbalance, and a single misstep on the way back to bed can lead to a dangerous fall. Low blood pressure plus thin blood also cuts oxygen delivery to the brain, making you prone to morning lightheadedness or brief confusion upon awakening. Many patients say, "I replaced dessert with 1 pear each evening. Why am I still exhausted by morning?" The culprit is 2 intersecting risk cycles: flavonoids plus antiplatelet meds right arrow overthin blood, and sorbitol plus diuretics or weak gut right arrow dehydration. The worst-case scenario often strikes at dawn, when the brain is most vulnerable as blood pressure bottoms out naturally. To enjoy pears safely without sacrificing sleep: 1. Limit to a half pear, approximately 80 g, and eat before 3 p.m. so flavonoids clear before any evening aspirin dose, if prescribed. 2. Choose pears still firm, greenish-yellow skin, a bit crisp, since they contain less sorbitol than fully soft fruit. Take small bites and chew the skin to gain fiber without releasing too much sorbitol at once. 3. Combine with healthy fats or protein. A few crushed walnuts or a slice of low-fat cheese will anchor the sugar, keeping the pear in your stomach longer and avoiding a strong midnight bowel rush. 4. Skip pears entirely for 2 days after your doctor increases your aspirin dose or adds clopidogrel. Your body needs time to rebalance clotting function. 5. Rehydrate smartly. Instead of downing 300 ml of water right after the pear, sip small amounts throughout the afternoon. By evening, 1 small sip is enough to wash down the dessert. 6. In case of overnight diarrhea from a late-night pear, mix a 1/4 tsp salt plus 1 tsp sugar in 250 ml warm water, and sip slowly to restore electrolytes and prevent morning lightheadedness. 4. Strawberries, the sweet trigger for a blood pressure storm. Bright red, fragrant, and low in calories, strawberries often tempt seniors to eat an entire bowl after their afternoon meal, unaware that each berry conceals a high oxalic acid content, far above most soft fruits. Oxalate loves to grab calcium. When older adults are on thiazide or furosemide diuretics for blood pressure control, drugs that already pull calcium into the urine, the oxalate in strawberries readily seizes the remaining calcium to form tiny crystals. Suddenly deprived of free calcium, the body reflexively releases vasoconstricting hormones, causing blood pressure to spike and then plunge erratically. Dizziness, heart rate disturbances, and tingling around the mouth can strike in the middle of the night. At the microscopic level, those oxalate crystals also send inflammatory signals to the endothelium of the brain's tiny vessels. The vessel lining cells swell slightly, their surfaces become sticky, and platelets more easily adhere, forming microthrombi. A scatter of these tiny blockages may not cause a full stroke immediately, but by morning the sufferer can stagger briefly, lose balance for a few seconds, and find short-term memory blurred like fogged glasses. The story doesn't end there. Strawberries rank among the dirty dozen because their small-seeded surface is prone to fungal attacks, so farms spray multiple rounds of fungicides and pesticides. The fruit's dimpling lets chemicals penetrate deeply, and a simple water rinse can't remove them all. Even trace residues of captan, boscalid, or thiram induce mild oxidative stress in the liver and vessel walls. The liver's detox workload grows, blood pressure medications are metabolized less efficiently, and the vessel lining releases additional cytokines that stiffen arteries. The combination of oxalate, chemical residue, and calcium loss turns a bowl of sweet strawberries into a silent blood pressure storm. Nighttime vasoconstriction, followed by an early morning systolic drop and rebound, cycles of cerebral underperfusion, prime conditions for microstrokes. If you still crave that summer flavor, limit yourself to 5-6 berries, approximately 70 g, and eat them before 10 a.m., giving your body the day to rebalance minerals and clear oxalate. Soak strawberries for at least 15 minutes in warm water with 1 tablespoon baking soda or apple cider vinegar. Stir gently, then rinse to wash away most pesticide residues. Diuretic users should leave at least 4 hours between their pill and any strawberries, and pair the berries with a cup of plain Greek yogurt or a handful of almonds, so calcium and magnesium can lock some oxalate in the gut. Avoid strawberries entirely on days you take a polyethylene glycol laxative. Both agents draw water into the bowel, risking diarrhea, electrolyte loss, and dangerous blood pressure drops. 5. Ripe mango, excessive sweetness turned dangerous. Among tropical fruits, ripe mangoes top the charts for aroma and sweetness, but that very sweetness is a sophisticated trap for the elderly brain and vasculature. A chunk of golden-ripe mango is almost a natural sugar lump. It delivers ample glucose that hits the bloodstream immediately and fructose that forces the liver to work overtime. Ripe mango's glycemic index hovers around 60-65, higher than a ripe banana and approaching white rice. Eating 150 g of mango in the evening can send blood sugar soaring to 180 mg/dl within 30 minutes. In response, an older pancreas must exhaust its insulin supply while the adrenals pump out cortisol to help lower glucose. That insulin-cortisol duo can ambush you at night. Insulin may drive sugar too low, cortisol holds sugar up, and cerebral vessels alternately constrict and dilate like plucked strings. Oxygen delivery to the brain dips with each constriction, starving neurons. Come morning, the sufferer may wake with a brief headache, wobble for a few seconds upon standing, silent warnings that the brain endured a thirst overnight. For diabetics, a single ripe mango serving can undo a day's worth of dieting in 10 minutes. Blood sugar spikes, then crashes under medication, triggering cold sweats at 2-3 a.m., followed by tachycardia and tremor. Patients on ACE inhibitors for kidney protection and blood pressure control are especially at risk. The mango's sugar and cortisol surge quickens the heart, the brain's vessels cycle pressure rapidly, and the ACE drug can't cushion those swings, creating tiny gaps where microthrombi form. At dawn, when blood pressure naturally surges, those microclots can dislodge into a small cerebral branch, causing a mild stroke. Slight facial droop, speech difficulty, or brief limb numbness that resolves in minutes, often dismissed as just fatigue. To reduce risk while still enjoying mango, 1 shift timing. If you want mango, limit to 80-100 g and eat between 9-10 a.m., giving your body all day to burn the sugar. 2. Pair with fiber and fat. Eat mango alongside 1 tablespoon soaked chia seeds or a few almonds. The soluble fiber and healthy fat anchor the sugar, slowing its absorption. 3. Never eat mango after dinner, especially if your meal was already high in starch. 4. Diabetics should check blood sugar at least twice after mango. If it exceeds 160 mg/dl 1 hour post-meal, reduce the portion further or swap in papaya or cantaloupe. Lower sugar, high-water fruits that naturally dilute the blood. 5. Prep properly. Wash mango thoroughly, peel off the skin, which can carry preservatives, cut into small pieces, and chew slowly so saliva starts breaking down sugar before it hits the stomach, easing the pancreas's load. 6. Avoid sweet blends. Don't make mango smoothies with condensed milk or honey. Liquids dump sugar into the bloodstream even faster than eating chunks. 7. Med timing. Evening ACE users should maintain a 6-hour gap between their pill and mango, and sip 150 ml of warm water with a pinch of mineral salt before bed to stabilize electrolytes. If your heart races or you break into a sweat at night after mango, that's your body telling you the dose was too much. To keep enjoying natural sweetness without triggering a nighttime stroke, here are 5 truly safe, brain-boosting fruits, provided you eat them at the right times and in the right amounts. Blueberries, rich in anthocyanins that improve neural conduction. Just a half cup, approximately 70 g, at 9 a.m. Avocado, monounsaturated fats that nourish cerebral blood vessels. A quarter of a small avocado with your lunch salad, no sugar spike. Gold kiwi, very high in vitamin C, low in sugar. 180 g fruit before 3 p.m. helps lower blood pressure slightly without spiking insulin. Pomegranate, powerful anti-inflammatory polyphenols. Drink only 100 ml of juice diluted 50%, consumed before lunch. Cantaloupe, high water content and potassium, low in oxalate. 120 g, after afternoon exercise, helps rehydrate without overfilling the bladder at night. Ideal breakfast for those over 60. Protein, 1 soft-boiled egg or 100 g Greek yogurt to stabilize blood sugar all morning. Fiber, 3 tablespoons oats cooked with 1 tablespoon chia seeds, simmered gently to form a protective gel in the gut and anchor blood sugar. Healthy fat, 1 tablespoon lightly toasted almonds or walnuts, provides omega-9 and reduces vascular inflammation. Hydration, 250 ml warm water with a few slices of lemon, primes the stomach and rehydrates after the long overnight fast. You can also sprinkle 50 g blueberries over your oatmeal to wake up the brain with anthocyanins, completing a perfectly balanced breakfast. The question is fruit good? But is that fruit good for you right now? The very same slice of apple or piece of mango that acts as an antioxidant in a young person can become a smoldering spark of inflammation in the brain's vessels of someone over 60. The difference between a happy armchair at home and a cold hospital bed can sometimes come down to that end-of-day fruit plate. Whether you swallow hastily or choose thoughtfully, whether you're careless or well-informed, that choice is yours. If this video has made you rethink your fruit portions, please hit like so I know the message reached you. Share it with loved ones. Sending just 1 link could help prevent a silent stroke. And I want to hear from you. How will you change your fruit-eating habits after watching? Leave a comment below. I read every line and reply. Don't forget to subscribe and turn on notifications. In upcoming videos, we'll keep unpacking daily meal strategies, turning knowledge into the key that keeps your mind sharp and your heart resilient.